started. We're recording, so welcome to the community briefing. Okay, we're gonna get started here. 11:04. All right. Good morning. Welcome to the community briefing. My name is Gregory Sneed. Today is the 24th of October in the 24 year of this millennial. So 10, 24, 24. So like 24 karat. We are here. Welcome. Our guest today is Darryn Harris. He'll be joining us momentarily. My name is Gregory Sneed, and I'm one of the co-hosts here at Community Briefing. Our other co-host is Crystal Mitchell, Robin Billups, and Stephen Turner. Stephen's here. I think Robin may come in later. And then Crystal is our Egyptian queen. She's currently in Cairo, Egypt. And so she is desperately trying to get our live streaming going there. It's probably might be blocking you because you're out of the country, potentially.
Hey, Crystal. Woo woo.
Okay. So, but we're glad you're here. So, Crystal, certainly take it away live from Cairo, Egypt.
Can you guys hear me?
Yes.
Oh, hello. How are you? Yes, I'm in Cairo right now. I am actually leaving in about 4 hours to head back to the United States, but I've had an awesome time here. Went to Luxor and Aswan, and it's been an amazing time. And I finally got the official name of Nana Crystal and Grandma today. So it was worth my whole entire day, 10 days being away. And so thank you guys for carrying on the show for me. I am Crystal Mitchell. I'm the co-director of Recycling Black Dollars and the co-director of Recycling Black Dollars. This platform is powered by Recycling Black Dollars and the BBA. And we have sponsors, Los Angeles LDC, Southern California Edison, PCR, Wells Fargo Bank, and SoCal Gas as our monetary sponsors. We want to thank you all for joining us. And with that, and we have an amazing team. So you've already met Greg, and Stephen is our producer. So he's a producer extraordinaire. So we want to thank him. And we have a great guest. We were just talking. I've known him for 20 something years, met him in his early part of his career. And now he is, I assume, running for senator. Yeah.
No longer running for senator. I deferred for a later election cycle, but I'll be back soon. Trust me.
Okay. So his career has been going upward like this, and so I'm so proud of him. And it's awesome to be here. I was hoping I had a stable internet time connection so I could be here with you. So with that, we're going to turn it back over to Greg.
Thank you, Crystal, and Stephen will join us later. And I don't know if Stephen or Crystal, if you heard from Robin, if she was joining us today or out of town. I couldn't recall.
She's at City of Hope today.
Okay, got you. Good.
Yeah.
Well, we definitely keep her in prayers. So our guest today is Darryn Harris, and he is the Chief Government Affairs and Community Relations Officer at St. John's Community Health. That's the largest healthcare provider in South Los Angeles and Compton. And his main focus is promoting health equity, access, and coverage for the most vulnerable populations. With almost 2 decades of extensive experience in local, state, federal, and political arenas, he's a passionate advocate for social and economic justice, and he uses his expansive network and unwavering dedication to advance policy solutions that improve the lives of Californians, and that includes us. He also has served as the chief of staff to, at that time, Representative Karen Bass, and was a primary advisor for all political and policy issues. And he directed strategic planning for the office. And during that tenure, he held impactful on-the-ground trips for the Biden administration here in Los Angeles. And also that included a report on the bipartisan infrastructure law and with the president and LA Metro. He has done various political leadership positions prior to joining that function. He was assistant director of government and community relations at UCLA. A few Bruins on the call here, and also worked as a field deputy and district director in the state's legislature. So he has been making legislative and budget decisions that impact our community. Okay, it looks like we got the live stream going. There we go. He is a let's see. He's deeply inspired by luminaries such as Philip Randolph, Martin Luther King, James Baldwin, and Dolores Huerta. He is a member. Oh, he's a member of Alpha Phi Alpha. Okay, oh 06. All right, there you go. The greatest fraternity out there, and the New Leaders Council, and holds degrees from Loyola Marymount and University of UCLA. He's a proud native Angelino, and he enjoys spending his weekends with family and friends, hiking and listening to live music. So, without further delay, please welcome to the virtual stage Mr. and brother Darryn Harris.
Well, thank you so much, Brother Greg. I really appreciate that. It's always good seeing a fellow Alpha brother. I feel like we're everywhere, especially here in Los Angeles. And thank you to Steve and Turner for extending the invitation, to me, to join you all this afternoon. It feels real good to be back home in Los Angeles after being away for some time in Washington, D.C. With our then Congresswoman, now Mayor, Karen Bass. And when coming back home, I had to make a decision. What did I want to do? And I found myself in community health because there were just so many issues that I learned that were impacting our community and our people. And I wanted to make sure that was on the ground, at the forefront in supporting those type of solutions in order to, advance not only our communities and our interests, but also just to save our people. Health is real, is real serious. And so I know that I don't have a lot of time today, and I do appreciate you all extending the invitation to me, and I appreciate you all having a very tight program too. But here just to talk about some of the things that are on the ballot. Just a few things that are on the ballot. As they say every single year, this is the most important election of our lifetime. I've been hearing that for over 2 decades. And I can tell you that that is a very, true and honest statement. But I can tell you, when I got my ballot this time, there's all this noise about what's at the top of the ticket, with Vice President Harris and former President Trump. But we have all these different ballot initiatives. And I said, what the heck is going on? And it sounds like, California is at a place to where we are, legislating, now through the, the ballot initiative process. And I'll save my comments about if I agree with if that's the best way to do it or not, because I don't think this is a space to do it. But I think that in order for us to do it well, we do have to have a formed electorate. And so I know there is legislation that is in Sacramento that is passing to make it more clear to us. But when you have so many propositions, on the state level, and so many ballot measures on the county level, and then you get to our cities and to our schools, it's kind of hard to figure out what is what, and what is real. And so what I'll do is I spend my time today, talking about three particular initiatives that are really impacting community health right here in South Los Angeles. And it'll be Prop 35. Measure A, and then Measure CC. And so I'll just, talk a little bit more about the problem, the solution, be as objective as possible when it comes to these, these different ballot initiatives as well. But I do have to say that I and my organization have, taken a yes stance on them. So this, you can look through the veil, just understand that we are supporting them. But I will be, as objective as possible. And then I didn't create any slides because I figured that I'll just do the big ballpark, figures and the headlines for each initiative. And then if there are any questions, given that at 10 minutes, then we can kind of dive and have some kind of dialogue that will go back and forth. And so I'm hoping that these initiatives are not new to you all. Hopefully you guys have all heard them. We just have a very great state in California to where I know that everyone has received their ballots already. When I talk to my friends in Georgia, they are, having some trouble, in regards to, not only with early voting, but a lot of them learn what's on the ballot once they get to the ballot box. They don't have things like sample ballots that we receive here. And so we do have we do take a lot for granted here in California, given that we all have sample ballots, very clear information about what we're voting on. And then now, coming out of COVID, we all receive our ballots at home to where we can make informed decisions before mailing them in, turning them in, or actually going into a voting center that is manned by professionals to where we could cast our ballot. So let me just start with Prop 35. Prop 35 um, is a ballot initiative that will address the most urgent um, healthcare priorities here in California, including Los Angeles. And then it will also protect and expand access for 50 million Medi-Cal patients here within, California. And so, like, why are we here with Prop 35? Why does this even make sense? And when I get into the weeds, I can tell you, coming back here to California and working in healthcare. Now, I don't have a background in healthcare. I have a background in politics. And as a chief, I was what you would consider a generalist, which means that you are kind of like expertise on a whole bunch of different things. But taking a deep dive within healthcare, I just saw this at the outset that California, this has a healthcare system that is just in crisis. We have hospitals and community centers that are, closing services. Our emergency rooms are overcrowded. More than 40 hospitals have stopped offering labor and delivery services. Patients wait months to see a doctor or a specialist. And so for care for 15 million seniors, children, disabled, and low-income families on Medi-Cal, we learned that it's unfunded. And so that's the problem, is that, we're having all this crisis where things are closing, where the emergency rooms are overcrowded, where we're no longer having labor and delivery services because Medi-Cal is significantly underfunded. And the state has repeatedly redirected more than $30 billion in healthcare funding to non-healthcare purposes. And so I'll save my color commentary there about what the administration is doing there. And so what Prop 35 will do, it will protect and enhance our healthcare system for those 15 million Medi-Cal patients. It will also ensure ongoing revenue. And so in California, the way our tax structure is structured is that when the rich are doing well, the state is doing well. But when the rich are not doing so well, then we end up with these massive deficits. And then we also see a trend to where the rich are actually leaving our state. We can save that conversation for another time to figure out, is it right or wrong for them to be leaving, or about our tax structure. But we do know that we do need ongoing revenue by extending existing tax on health insurance companies. So unlike the other initiatives I'm gonna talk about with tax, sales tax on the individuals, or even through a bond measure to folks who own property. This particular initiative is a tax on health insurance companies. So it's not a tax on individuals. So we're not raising taxes on individuals, and we're dedicating these funds through this initiative to protect and expand access to care. And this will prevent the state from redirecting these revenues for non-healthcare purposes. One thing that I've learned about being in community health is that, everyone loves their doctors, they love their physicians, they love their providers. But when things are at the chopping block, unfortunately, community health centers don't have the power or the muscle, to protect their patients. And so often, like, the most vulnerable people, we talk about community health centers, teachers, the folks who need the help most are often, suffering. And so with Prop 35, as I mentioned before, not only we're improving healthcare for access for 50 million Medi-Cal patients, but this is going to improve the health for all patients within, California by ensuring a dedicated funding that cannot be redirected. So that means we could count on that funding. And it also will fund healthcare worker training. There's a deficit in healthcare workers. And so as we think about, the pipeline for folks getting into, healthcare, where these may be nurses, mental and behavioral health specialists, billing, you name it, we need to figure out how we're going to be able to increase, the pipeline for folks, entering the healthcare workforce, that's sustainable in order to meet the demands. Of tomorrow. And so that's pretty much what what Prop 35 would do. It dedicates funding for those 15 million people, expands access to prevention and healthcare. It reduces the wait times in emergency rooms or emergency departments, like our at MOK Community Hospital. It's funding for our primary care physicians, our community health centers like St. John's, where I am working, specialty care for cancer, heart disease, OBGYNs, family planning, and also hiring most first responders and paramedics to reduce emergency response times again. So when you call 911, this will be able to reduce that because we'll have the workforce in order to meet the need through the healthcare workforce training to address the workers shortage. So as you go through your ballot and you think about Prop 35, just understand that this is a tax on health insurance companies to make sure that we're meeting we're meeting the demand, the healthcare demand, for our most vulnerable, folks. I think I got questions on the side. Oh no, that wasn't for me.
Quick question: is that a permanent tax, or is there a time limit on it, or how does that work out?
So I believe this is no sunset. This does
Okay.
not have a sunset. So there are questions, and I mean I can't talk about this. Is overwhelmingly supported. This is not by community health, but this is supported by a coalition of different folks. So you have the dentists are supported in the California Medical Association are supporting. So we have the doctors. We have the community health center network, which is community health. I believe we even have, the anesthesiologists who are supporting it as well. So it's a full coalition of folks who are supporting this work from Planned Parenthood, as I mentioned, St. John's Community Health. The NAACP is supporting it as well. Black Women for Wellness are supporting this. United Forum Workers are supporting this particular initiative. Asked me, and then most recently, the LA Times. They can't make up their mind who they want to support for president. But the LA Times did, support, Prop 35 because it's what's needed to be able to forecast what we need for healthcare going on. So as the state hits this, volatile tax structure, and we start to make cuts, we can ensure that our community health would be, saved. So no headlines there, no fireworks there. You can just
I
guess
agree.
on 35. What you are probably a particular initiative that's probably hitting closer to home is Measure A, and I'm sure you guys are all familiar with Measure A. I'm pretty sure someone has talked to you all, even if it's not with this body, but then different bodies. But as you all remember, I want to say about 10, 15 years ago, there were these two big initiatives, Measure H and Measure HHH. One was through the city, one was through the county. And it was the way that these two bodies were going to address housing and homelessness within LA County. The issue is that was a tax, a half-cent tax on residents, but it's going to sunset in 2027. So by 2027, they will no longer have that funding. And what that means, if with that particular initiative sunsetting, that means that almost 50,000 people will be pushed immediately out into the streets. There will be 11,000 people in South Los Angeles alone. And so at any given night, according to the homeless count, we know that there are about 75,000 people with the LA County, this is countywide, who are just homeless for the lack of available affordable housing and or for lack of substance and mental health treatment. And so I won't go into all the stats because we're all familiar with the particular issue of housing and homelessness within LA County. But I can tell you that I am a little afraid because on Monday I was having a conversation with a particular lady who works in healthcare. And she was recalling the conversation she had with a lady who, and these three ladies, they all work in homeless housing services. One is an actual housing provider, one takes care of mental and substance abuse, and one is working more on the healthcare side. And they were saying, well, I just don't see it. I don't believe in it. People are taking advantage of, the services are out there. And so it was a little troubling to me because I know that if this does not pass, what this will look like. But it was also troubling because when we think about the folks who are homeless, over, women, a lot of, the folks are Black, they're Black. And the number one, population, of the homeless community that's increasing are senior citizens who are Black women. And so she was just saying, she was like, well, I don't see them. Well, because they're hiding. No one is, out there in the forefront, they're, getting the care that they need. And so we do see that some of these programs are working through Measure H and Measure HHH. We do know that, this past homeless count, there was a drop as far as the number of folks who are on the streets. But we do know that even with the homeless count, we're not capturing everybody. It takes about 2 years for someone to actually hit the streets when they're homeless. Usually they may lose their mortgage, or they may be one of these predatory housing complexes with one of these different companies. Then they may stay with a relative for a few months before they're kicked out to their cars or their RVs. We've seen those before. The RV be ticketed, booted, impounded, and then we see that folks are ultimately on the street. And so we do also know that there's an intense need for mental and substance care. I remember telling the mayor, this is when I was her chief, that we're not going to be able to build our way out of this. There's no amount of housing that we're going to be able to do to build our way out of this. We're going to need complete wraparound services, enhanced care management, to really, address the need. And so at St. John's, I know that we're doing our part. This is aside from the measure, is that when the mayor talks about locking arms across the county in order to, solve the solution, we're trying to, get folks before they even hit the streets. And so as folks come to our clinics, we're asking a simple question during intake: have you missed a rent payment? Because we know that if you miss rent, there are services out there that we can kind of help you, or at least mitigate in some kind of way, because it's easier to keep you housed than to have someone hit the street, and then get them housed. And our laws were just backwards. For a lot of our programs, you had to hit the street first in order to get some of the resources. And we know that just doesn't make any sense. You want to keep people housed if you want them to be safe, or you want them to be, positive contributors to our, our society. And so, Measure A is real simple. It just makes LA County safer and more affordable by ensuring that those 50,000 people that we're servicing, whether it may be veterans, domestic violence survivors, or people with mental health concerns, can keep their housing and care, and that they just don't return to homelessness. And so when we have an emergency, when a house is on fire, you got to put the house out. You have to put the fire out first, and then you have to think about how you're going to build. And so Measure A is going to just make sure that we, number one, just stop those folks from hitting the street, again. But it goes a little bit further than that. It creates more homes that Angelenos can afford. And so you have housing advocates like Habitat for Humanity that says that Measure A prevents more Angelenos from falling into homelessness by increasing everyone's access to affordable, safe, and quality homes. For me, I live, this a stone's way out of downtown. And so I know that this would mean safer streets. You have the paramedics, the ER doctors, mental health nurses support Measure A because it removes encampments faster and helps people with serious issues get better treatment and housing. So it actually treats the need of the people. But Measure A goes one step further than Measure A and Measure HHH did do, because there was a problem with the city and the county to where there was a practice or tradition to where they just weren't working together. They said, that's your job, this is your job. And so Cindy Comlager Dove, when she was in the state legislature, she led a piece of policy that kind of created this La Casa. So it's almost like the Metro for homelessness, to where it's not the city's fault, it's not the county's fault, but everybody's working together under this umbrella. And so what Measure A does is it creates real accountability. And I think that's what was missing with the other two initiatives. With this new approach to homelessness that would increase, transparency and accountability with public audits and spending reports. Because when you look at the spending, and this is, some dated information, you want to make sure that the spending is actually meeting the need for today, and then you don't have folks who are just in the business of this, of homeless services for the sake of, providing homeless services. And so what Measure A would do, it would change the law to ensure that funding goes only to the most successful programs. And I think that's where we will see a big change. And so, as I mentioned before, Measure A is, it's one of those other initiatives that where the LA Times has, endorsed, and in addition to a sundry of folks, all over, the city, from United Way to SEIU. As I mentioned before, St. John's is supporting this initiative too. And so, Measure A is, definitely something that we need to do. We need so much more. I have my own personal, comments about homelessness, about how everyone can, address it from the federal level all the way down to the school board. But this is one way that we can ensure that at least there's funding, for this on a county-wide level. And the third initiative that I, want to talk to you about, this is for folks who are living in the areas that are surrounding Compton College. There's a measure called Measure CC. And what Measure CC does is Measure CC, it's a bond measure. And what it's focusing on is career and job prep for the folks at the college, and also health and safety repairs. And so most college students at Compton College, qualify financial aid, and many other, as you know, are the first in their family to go to college. And so what Measure CC and Compton College, this is for folks who live in Compton, Paramount, Linwood, Willowbrook. So if you have relatives, are you seeing in that area, this is for you. So I'll be real short with this one, because I know it doesn't affect everybody, and it's a little bit outside of South Los Angeles. But Measure CC ensures that local students and residents can access high demand, good paying jobs and careers for quality life. So this works in hand with Prop 35 when I talk about that shortage of healthcare providers, and ensuring that we have our kids. I don't even say our kids, because most of the students at Compton College are not kids, or non-traditional students. So let me correct myself. But that folks for our communities will have access, to those jobs. There have been a few things that have changed within healthcare. For instance, before, to be a behavior therapist, you had to be an LCMS. But we learned that most of the folks who were, who were Black, had MFTs, because there's a barrier to get into LCMS. Why? Because you need all these volunteer hours. I don't know who has enough time outside of their own job, in their own life, to just go volunteer thousands and thousands of hours, and then we're talking about, well, there's a health shortage within mental health. Well, you have people who are MFTs who have the training, they just don't have the license. And so the governor did pass a particular assembly bill this past. He signed a piece of legislation that would allow those MFTs, to be able to offer, behavioral health, within a clinical setting, and we be able to build back through Medi-Cal. But what this particular measure does is ensure that our students are trained to get those jobs. Because, I look at healthcare as a public health issue, but healthcare is also jobs. There's a lot of jobs within healthcare. And so we have to make sure that we're at the forefront to get that. And so what this particular initiative does ensures that we are preparing our students for those high demand, good paying jobs and careers for a better life. This also affects the housing and homeless situation. You have a good job, most likely you won't end up, within, housing, homelessness. But what Measure CC does particularly also is it would allow for them to build, update their buildings at Compton College as well, all their classrooms, all their facilities, their quad, including a 24-hour urgent care center. And so this 24-hour urgent care center is going to ensure that both students and community members have access to medical care at any time, day or night. And then what this would do is that it would take some of the pressure off the MOK community emergency department, because there are certain needs that we have within our community, health needs, that are not necessarily at the threshold of emergency department, but you may have you may be experiencing an asthma attack in the middle of the night where you need some help, but you don't want to go to emergency because they're going to make you wait there for 4 hours in an uncomfortable way. And so these enhanced care services are going to offer a wide range of services, including primary care, dental, behavioral health, urgent care, and also screening tests, excuse me, and also additional services like screening tests and health insurance enrollment, for the folks. And so this will, really, be a considerable, need within the community, to where we know that over 307,000 residents, within the area surrounding Compton College, that's Compton, Linwood, Paramount, and Willowbrook, and often, Black and Brown folks will get the type of services that they need. But then again, it also offers the support for the students and the community at large. So, I mean, I would just leave it right there because I know I'm running out of time. But if you have anything, I would just say yes on 35, yes on Measure A, and also yes on Measure CC. And I'll leave it there, and I can answer any questions if there are any. Hey, Emma, how you doing? I didn't see you sneak in here.
One quick question. Measure CC is just for residents of Compton?
Yeah, is this for the residents for the Compton Community College? So that would be Compton, Linwood, Paramount, and Willowbrook, and some of the other smaller areas. So if it's a smaller campaign. So that's why I said folks are not really hearing a lot about it. But if you live in those areas, or you have family members or friends, if you worship in those areas, just make sure you let them know about Measure CC, because this will be a 24-hour urgent care center, state-of-the-art urgent care center that's going to really, offer the services that those 307,000 residents desperately need.
Great. Crystal, I had to take a break there. Did you see anything in the chat on those measures that I missed? You're muted, Crystal.
Michael Banner had a question.
Michael, you able to come off mute?
Am I off mute? Can you hear me now?
I was asking Michael if he was able to come off mute for his question. I guess his question here is, who can actually afford this 0.5% sales tax?
Well, I'm not an economist, but I'll make my. I would say this. I don't know what other solution we have right now in addressing housing and homelessness. And I don't think that this one particular measure is going to be a silver bullet that is going to address all the needs. If I had the time, I think that there has to be a very comprehensive plan that where everyone from the federal government, the state, the county, the cities, I even mentioned the school board, and these are my personal opinions right now. So I will just say that these are my own personal opinions. We'll need to do something to address, some of these issues. I think that the federal government needs to, make a strong investment in workforce housing, which is different than low income housing. We can worked in Congress, for over a decade. So I know that it can be done. And so, and because it's hard to get a cost of living adjustment in California, because of the cost of living is so high here, so that means it's so, tremendously above the federal poverty line. We find out that we may need to move into that next bracket with the, workforce housing. So I think that may be something that we need to address. LAUSD, has more land than anybody else, and here. And so, I mean, I look at all these campuses, but I often question myself and saying, why are students leaving tents to go to a campus? Why can't we build housing here? And what can LAUSD do to do that? We built all these beautiful schools, about 10, 20 years ago, and it take us off the tracks. So, we have the political will to do that, then I know that we may need to look into, some type of measures where we can maybe house, if not our students, at least house our teachers. I mean, there are stories to where I know there are folks who are teachers who are homeless, teachers who are homeless. And so this is just how bad that it has been. So I'm not sure who can, afford this half cent sales tax. But I know that this is what we have right now. And without it, I know in 2027, we're going to see, 50,000 people countywide pushed onto our streets, 11,000 alone, within South LA.
Wow.
Hey, Darryn, can you hear me?
I can hear you, Michael. I can hear
So
you.
my question really kind of goes to, if we have a population that is at risk, as you just characterized, to being on the streets, and their rent burden, which means whatever percentage you want to use, but a substantial portion of the income goes to paying rent. The other portion goes to living every day, right? Which means it's a consumption spend. And now if your consumption is going to go up another 0.5% because sales tax are higher, I just have a problem thinking about how this is not a circular problem, where the people who can least afford to pay a sales tax increase are going to get stuck with it too.
I can see your concern, there. My hope with Measure A is that, that the half-cent sales tax that is being used will have a greater level of accountability, so that we would know that the dollars that we're spending, are being, used in the best interest to solve the problem. And I can't say that's the case right now. But I do see your concern, and I wish I had a way to respond to it. Unfortunately, I don't. But I do know that this, new measure at least comes with a stronger amount of accountability, to make sure that the folks who, to make sure there's not that help, that half sales tax is not being wasted. Just it's at least being useful. I will say that.
Thank you.
I do know that and with some medical insurances, they're now doing quarterly health checks. I'm with Kaiser, and they send me a quarterly survey to make sure what my needs are, whether it's housing, whether it's food dependence, where I can't make the utilities. But that's Kaiser. So, but it does seem like, if, as you said, if we could preempt, the word, I guess it'd be preempt the positions where people find themselves, their next step is on the street. And it does take a lot to get to the streets. But if there was like someone or something that could assist that. And it's interesting. I'm in Cairo, and of course, Cairo has 25 million people that live in Cairo, not
Oh
around, not
my.
Egypt, but 25 million people in Cairo. And we've been all over, and I've only probably seen 3 people sleeping on the street. And
Wow.
um, they do have a lot of old buildings, and their president is now rebuilding a lot of the old buildings. But there is nothing like Social Security. There's nothing like that here in this country. And I'm not quite sure how they do it, but with 25 million people, and the poverty level here is far lower than anything that we have in California for sure. And I don't know how they do it differently, but I've only seen 3. And when I was in Lexor, I saw none.
That's amazing, Crystal. And
And but I mean, they're poor because the American dollar is 48.58 to 1 Egyptian pound. So it costs a lot. And I know my niece has been talking about how much more expensive it is. And it is, I saw it, and I'm a tourist. So the amount of money that I converted when I first got here and I had to go back several times to make to do that. The first 2 times I was here, I only had to do it twice. but I had to do it 4 times to go back and convert money just to be able to, because everything is very expensive. So I don't know what I think, Darryn, you're absolutely right. If we had been a way we could have preempted all of this in the beginning, because it seems like it's like hopeless, and the medical system has seemed like it's hopeless for people that are in need.
Right. And I just, when I think about, I mean, the thing that hits me when it comes to, the unhoused community is that, they say 3 to 4 people are dying every night just from being on the street. And those people are Black people. They're Black. If
Of
this
course.
was an issue that was affecting any, as I said, the growing number of homeless folks are older Black women. If this was any other community, I'm sure there'll be expanded senior services. There will be the will there. But because it's Black people, I think that sometimes folks don't see us as being human, and so it's our fault. And so, I mean, I know that it seems like a lot, but if it's like it's a half of a half a percent on sales.
Right.
If that's my one part that I can do to solve the problem, nothing else. I'm not out there. I'm not a service provider. I don't have to go out there and clean up anybody. I just that's all I got to do. Let me just do my one little part. In order to really solve this issue for our communities. Yeah, there are other folks that are taking advantage of it. They fly in from all over the country because we have these services. They want to be in Venice and whatnot. But the majority of the people on the street are Black. And so that's
Right.
why, we have to really look at it as, what are we going to do in order to, protect our community? The majority of those kids are our kids. Those are Black kids leaving tents to go to school. And I don't think that folks have really humanized it because those particular people are hiding, and so you see the guy out there having an issue. You see the person taking advantage of, housing, at some different facility and whatnot. You don't see the people where the true need is. Folks who have domestic violence issues, folks who are, dealing with substance and mental health issues, and then folks who are just sick. People are just sick. So, and this is an issue that people are, dying 3 to 4 every single night for no other reason for just being poor. That's just it.
I have a comment. We are replacing Measure 8. I'm sorry, H.
Emma, can you
with
hold on a
A.
minute? Emma, can you hold on just a minute? Shamika had her hand up. She's been
I'm
waiting
sorry.
patiently. Yeah. So, Shamika.
Oh, hi. I was going to echo what Mr. Harris said. The 2 cent, I mean, the half a cent, if we don't vote to give them half a cent, someone else is going to come in and present a measure and we're going to end up paying for that one. I just feel like why not? This is going to have some accountability attached to it because I'm kind of on the ground. I'm at eviction court. I'm seeing what's happening. There's a lot of illegal evictions going on. 76 or 78,000 evictions were filed at the end of last year. So that's a real thing. And a lot of the people that are being taken advantage of are the elderly. And in most cases, senior citizens, most cases, they're not even behind on their rent. They just live in a low income unit or they live in Section 8 and someone just bought the building and don't want them there anymore. And they don't have the mental clarity to be able to fill out something as simple as an answer. Well, an answer is not simple. So I just feel like if this measure is going to assist, half a cent to assist or have accountability so that our seniors can be protected and our mentally ill can be protected, I mean, we might as well go for it. I'm not trying to tell anyone what to do, but I know in a few months, someone else will slide in and try to get us to, present another measure, and we're going to be paying extra 5 cent sales tax. So everyone has their agenda. So let's just, consider what we're trying to do. We're trying to protect our most vulnerable. And yes, it's a lot of us that look like me and look like you that's victims. They go to these agencies and there's too much gatekeeping. They cannot get through the door. I'm seeing what Sarah just posted. That's real because those are my clients. I send them to these agencies. They're turned away. So I think we should really, really consider what we're doing and why not half a cent, you know, to protect someone that could be our aunt, our uncle, our brother, our sister. That's all I wanted to say.
I agree. Hopefully, one day we figure out a way of redirecting some of the sales taxes and taxes that we're paying already. We had California State Treasurer Fiona Ma trying to figure out where a lot of this gasoline tax goes and surcharges, clean air. I mean, we've cleaned up the air that was implemented in the 70s when we were still using leaded gasoline. You know, why can't we redirect, some of that? And I've asked questions, where does this cannabis tax go to? That's a tremendous amount of money. Where does it go?
Is it for plastic and paper bags? How about that one?
That part. That part. Emma, you had something to share?
Wanted to agree about the half-cent tax. I think we are repealing H in 2027. So you're paying on that now. It's just replacing what they're doing for H. But I do agree. And I actually want to tell anybody that want to go through their ballots and figure out what we're doing. I'll be happy to talk to you. And of course, we're having a meeting next Wednesday at the townhouse, and we are going to do that. We will go through every single item on the ballot. Does not matter where you live. And we will be happy to help you. But if anyone want to call me right now, my ballot is completely filled out. I can tell you all the measures, judges, everything. You don't have to agree with me, but I can tell you what I have, and I can tell you why I have it. So to help you out.
Thank you so much, Emma and Roz. Thank you, guys.
We go through everything. We're going to be there till midnight.
Now, listen.
It's a lot on the ballot. I mean,
It's
so
a lot.
much.
It's a lot.
This is
It's a lot.
book.
But you know what? You got to take it in sections. And I was looking, I thank you so much for the presentation today. And all the measures that are on the ballot, I actually voted yes for all but one. Just telling you. I'll tell you why later.
Which one? Yeah.
Darryn, thank you so much, what you did. And the reason I kept throwing my thumb up, I agreed with you. And then there are some measures that are not on everyone's ballots. And so the last one that you did, it was not on mine. But every measure, I'm in District 10, and I'll tell you that. And every measure that we're looking at, I voted yes, except one. And I don't know. Is this? I'll let you know.
Everybody going to hit up Emma in the chat. So, Darryn, what's up next for you? I mean, the election, season wraps up in just a matter of days. But it's the fight doesn't end. Things have to continue. So, what's on the horizon for you, or what's something on the horizon in the year 2025 that's coming up that you can share with us?
So one thing that I'm looking at, and this is a real exclusive because I just started thinking about this a few weeks ago. But I am thinking about what's after the election, and I'm really looking at food. A lot of folks are talking about housing, but no one's really talking about food security within our communities. The fact that we're going to have more grocery store closures within our communities. I went to a grocery store the other day. The produce was not fresh. I can't even think about what the meat was, like. There's fast food places everywhere. So I know that I'm thinking about, food, because when the community health center movement started, and I won't go too long, back in the 1960s, it started because a particular physician went down to the Mississippi Delta in order to treat kids who were malnourished. And so he said, well, if folks are malnourished, you give them food. So he started writing prescriptions for food. Of course, the federal government didn't like it. He got in trouble. This particular physician ended up being Dr. King's, physician. But here we are, fast forward 60 years, And there are so many issues that are just around food, whether it might be the diabetes, hypertension, weight management, our teeth. Everything is about food. And so, what ways can we ensure that, we have more, healthy food options? I'm not an expert on food. As I mentioned, I specialize being a generalist. I like being that. But what I like is trying to solve problems. And so, now that there's a trend of these urban gardens, we have an increase of, small businesses, who are, are restaurants who are popping up within our communities as well. And so, let's look at the whole ecosystem about in what ways can we really use food to treat a public health problem. So I'm going to really, try to test that out. I was just talking to a few people about that as of Tuesday. So this is two days old, but so don't hold me to it. But if you see anything that you see me coming out in the future about food, a campaign around it, just say we heard it from him first.
Yeah, no, that's
I think
important. I was at Taste of Soul this past weekend, and I can tell you that there's no shortage of food. There's some folks down there that they're not starving at all, but they're not eating healthy. And even there were very few. I mean, it was rows and rows of vendors. There was very few offering any healthy fare. Lots of fried stuff, a lot of things heavy in calories and sugar and things that can lead to issues. So that's a very noble cause for helping the absence of food for many of us, and then perhaps for many the abundance of food, or certainly the abundance of calories and sugars. So that's
Now, I like fried foods. I'm not gonna say I don't at all. But
right,
but I do agree.
but 7 days a
I
week,
you get what I'm saying.
I was a friend of mine had moved to the South, and she was like, they get sticks of butter and they fry it, so yeah, that part. Crystal, over to you.
Yeah, I agree. Actually, I've noticed that there are a number of churches that are creating community gardens, especially in my zip code, which is 94043. That the churches are actually starting to put fresh gardening, growing gardens, and I don't know if it's to feed that area that they're in, but I would assume. I do know the one that's down on Angeles Vista. That's what they do. I've met a couple of the gardeners that do that in Lamert on Dinker. There's a community garden that everyone from that community can actually come, and they grow it just specifically for the community. I believe Compton has one as well. And I think there's one in further east in South Central. So that's an idea.
You're right about Compton, Crystal.
Huh?
You are right about Compton. They do.
Yeah. So maybe like that would be, Darryn, if you're going in that direction, maybe churches with CD that are what are they, CDF CDCs that actually could find some funding earmarked for just that. And if they have the land space, which a lot of them do, I know one church near my house, they just pulled up the dirt that was there anyway, and it wasn't being used, and now they're putting in raised garden beds, and then they hire someone. It's a local guy. There's 3 of them, I think, in the View Park, Windsor Hills, Lamert area that are doing that.
I just saw that the gas company gave $75,000 for a community garden. And I think it might be in Marquise's district. And I know Heather was there, but they are doing it everywhere. And the funding is out there. And real quick, I put all of the ballots that I voted yes on in the chat. And then the one I voted no on is also in there.
Okay.
Great.
All right, guys.
Well, Darryn, thank you so much for joining us. We appreciate you having here. Stephen, you still on? We have next week. We have Stephen, you there, or should I do the?
Yeah, go ahead. He put it in the chat. So
okay, yeah. So next week's guest is Simona Caldwell, and she's with the Los Angeles Sports and Entertainment Commission, and so she's a director with the Business Connect. So to be joining us then. And also, Yolande is up. Are you still on there? She has information about what's happening for what you call it? Oh, something going on here. The for the BSAP with the
Yep.
LA Unified meeting with the lawyers there.
Yeah.
I did
On
attend.
Zoom. If you go to our website, you should be able to get the link. If you're a NAPI member, you should have got the newsletter already. It's from 11 till 1 on Saturday.
Yep. And
Thank
nappies
you.
with nappies with 2 A's, not this nappy.
In nappies with 3 A's.
3 A's. There you go. Right.
3 A's PY. Thank you, Craig.
Thank you, Lande. Mm-hmm. Okay.
All right, guys, we're gonna sign off. We want to thank you all. I'm getting ready to jump on a plane in about 2 hours for my 47-hour
Safe travels.
flight
Safe
home.
travels. Yeah, definitely. Thank you all for joining us, and we hope to see you next week. And certainly educate yourself. Read through. It's a lot of reading on the ballots. Some of it is lengthy by design, but be an informed voter and definitely vote and encourage others to vote. Darryn, again, thank you for joining us. 06.
Thank you, Darryn. Thank you.
Thank you, guys. Thank you.
Great job, Crystal. Look forward to seeing you.
Great job.
Okay, I'll be home on Monday.
All right.
Very good.
Okay.
Okay.
Bye-bye.
Thank you, Sarah, and everyone else.
Everyone else.